thank you very much. That started. So as I say, this is the first session online for the Centre for Health Promotion Research Seminar Series. We're very pleased that we've got an external speaker with us today. So as I say, the meeting's being recorded so that it can be shared afterwards. We're going to try and stick to the timings today. So we're going to try and finish fairly promptly at 12:45. We will have some time for discussion, but if we start to overrun, each of the presenters is quite happy to be contacted via email outside of the meeting in order to continue the discussions and to share the information further. So first of all, I'm going to hand over to the director of the Centre for Health Promotion Research, and she'll formally welcome our external speaker.
Great. Okay. Oh. I think, can anyone hear an echo, or is it just us here in this room? We're okay. Chris, the take control button has disappeared, so can you move the slide on for me? Hi everyone, I'm Anne-Marie Bagnall. I'm the director of the Centre for Health Promotion Research. And I am absolutely delighted to welcome our external speaker today. It's Dr. Ursula Griebler. She's a senior research associate in the Centre for Evaluation at the University for Continuing Education, Danube University in Krems in Austria. Ursula is responsible for evaluations of health promotion measures, as well as projects in the field of evidence-based medicine. And she's visiting us at CHPR as part of a research stay to work on projects that we're both that we're all interested in here in health promotion research. And today she's come to talk about where are the men, barriers to participation in health promotion offers in the community setting, some qualitative research. So I will hand over to Ursula if you're ready.
Thank you very much, Anne-Marie, for this kind introduction. And thank you for the opportunity to present our research on men in health promotion. Obviously, I was not doing that all by myself. So thank you very much to my colleagues. They are listed here in this first slide. And I also want to say that this work was supported by the Lower Austrian Health and Social Fund. So what we know is that men have more adverse health behaviors and they die younger. They are less likely to seek primary care or preventive health care services, and they are often not as present in health promotion interventions or programs as women. We know from our practice partner in Lower Austria that the participation rates in programs or seminars and workshops range between 8 and around 20%. Can you hear me all right? Or... Yeah, okay.
Thank you so much.
Okay. And existing evidence synthesis on this topic were done on men over 60 or on evaluations of men's sheds for men over 50. And we recently finished our own evidence synthesis focusing on younger and middle-aged men. And there we saw that almost all included studies were from English-speaking countries. So over 90%, and we have included 78 studies, and none were from Austria. So that's why the aim of this project was to identify the preferences, attitudes, and barriers related to the use of health promotion services in healthy communities among men in Lower Austria. And here on this picture in red, you can see Lower Austria. This is one of the 9 federal states in Austria, and it's the largest one. It's just going around Vienna. That's the light spot in the middle. So what did we do? We did qualitative interviews with men, and you see the asterisk here because we wanted to include men and persons who identify as men. And these were our inclusion criteria. So they had to be living or working in Lower Austria with a low formal education. And we had these two age groups between 15 and 29 or 45 and 65 years. And we didn't want them to, or we wanted them to have little or no use of health promotion offers so far. We did altogether 28 interviews, 12 so-called classical interviews, where we recruited them via flyers in primary care facilities. We did social media posts from the department and also from our practice partner, and by word of mouth. And then we sampled them according to our inclusion criteria. But we also did so-called opportunistic visit-based interviews. So we thought that we could just go into the setting and talk to men there, because it's quite a barrier to sign up for an interview. And so we went to 4 different settings. We went to a car dealership, a local conscription office for the army, a beekeepers association, and to a barber shop. And we did interviews directly there as well. These were a little bit shorter than the classical interviews. So the characteristics of the men that we interviewed, we had like half of the younger age group and half of the older age group. We also had a equal distribution by the size of place of residence. And we aimed to have low formal education. So 2/3 did not have a school leaving exam, and 1/3 had upper secondary school, and a few also had a university degree. Because with these opportunistic interviews, we did not sort out anybody who did not, who was not exactly fulfilling our criteria. And 4 persons also had a migration background. So when we come to the results, I'm presenting you the barriers and facilitators for taking part in health promotion offers in the community. And roughly we have 3 categories of barriers and facilitators. So there were factors related to the health promotion offer, personal factors, social and social and cultural aspects. So I'm going through these 3 categories and presenting you the results. So when starting with the factors related to the health promotion offer, we saw that there were factors related to the content, the format, and also the trust in the facilitator. Many men said that they perceived the health promotion offers as too female. For example, if it's about yoga or meditation or about cooking classes, so they felt it was not tailored to them. And also, if the personal benefit of participation was unclear, they wouldn't participate. Some also said that there is irrelevant content or not going beyond any basic information or no new insights, so they wouldn't participate. So on many of the slides, you will see the quotes or some quotes that fit to the findings that I'm presenting. I don't want to read out all the quotes, but you can have a look at them. So as a facilitator, it turned out that the health promotion offer really needs to address men's specific interests or needs and target a concrete goal, for example, training for a running event. Also, informal and interactive workshops with opportunities for discussion were preferred. Then especially younger men said that fun is a factor that is important for them, a relaxed atmosphere, and also relatable communication with facilitators. Here in this quote, they said on an equal footing, so not that you get lectured by the facilitator. Also, if similar men are in the participant group, that was a facilitator, and also that the expertise or the competence of the facilitators were known beforehand. And especially young men said that municipal health promotion offers were not attractive to them at all. Being informed about offers, that's also an important point. Many men said that they don't even know about offers in their proximity, not in their municipality or their workplace, or also from the insurance provider. So this information should really be actively disseminated. And what turned out as a facilitator was that knowing other men from your social circle that they are participating, that was, thought as really motivating. Especially older men said that they hope that physicians, or that they think physicians should inform them about relevant health promotion offers, and they don't do that so often. In terms of time, place, or setting, maybe you could mute yourself. Somebody is unmuted. Yeah, okay. So unfavorable scheduling, for example, during working hours, or if it's not flexible enough. So some people said it's good to have a day in the week, and others said that doesn't work for them because they have flexible working hours. But also the geographical distance and the proximity in rural, especially in rural areas. If there are no offers nearby, then they would not think of taking up any offer. So facilitators were mentioned, like that the offers are integrated into the workplace, and there would be really important if it's supported by the supervisors, and if it could be done during work hours. Especially young people mentioned that school as an access point is good. They were talking about their own workshops that they did in school, and they found that very helpful. Especially for mental health related offers, anonymity was important, and some also said that monetary incentives would motivate them. Now, turning to the personal factors, the own inner resistance, and in German we call that innerer Schweinehund, and the literal translation would be the inner pig dog. I don't know if that's a thing if you have that in English, but it's this person inside you telling that, no, I can't do it, I don't have any motivation, I don't want to, it's much nicer to sit on the couch and eat crisps. So that's a huge thing. And also the lack of will to change, or no wish in general to engage in such activities. That was mentioned to prevent people from taking part in health promotion offers. And then for young people, but also older people, said that when they were at a young age, they had a lack of awareness that it's important to maintain health at a young age. And they just realized later on that it should have been that it would have been beneficial for them. On the other side, facilitators are positive role models, of course, and also this gentle social pressure where, your friend tells you, oh, come with me, I'm going there every week, and this really helps. Also personal goals and the genuine willingness to do something for yourself. Then establishing routines. And also some older men said that the health promoting behavior for them was a sense of reward and enjoyment. Then we saw that there is a group of men who don't have a need for health promotion offers. They don't see any additional benefit because they manage their health already effectively themselves. So several strategies were described regarding, for example, physical activity, social contacts, hobbies, time in nature, healthy eating, adequate sleep, or the mindful use of alcohol or nicotine. So they don't need any offer, any program, they just do it themselves. Also, the absence of symptoms or physical discomfort, they were just not thinking that they would, need to do something for themselves. In this one quote, one man said, "Well, as long as nothing hurts in the morning when I get up, everything is fine. So no need to do anything." And especially also for the older men, the motivation to do something only sparked after experiencing serious illness or chronic symptoms. So a facilitator is if they take responsibility themselves or organize own activities or groups. We had several men telling us that they have installed their own groups and how they motivate others to join them. So now coming to the social and cultural aspects, the gender norms and shame. This is still prevailing, and it was in all the age groups. So participation in health promotion offers was associated with weakness and perceived really negatively. So there is still this masculine norm that men have to handle everything by themselves, and they have a fear of negative judgment if they go somewhere and they take up help from somewhere. And offers were considered unmanly, and of course there was also shame and the taboo around showing vulnerability. On the other hand, the influence of the social circle, I have mentioned this before, it really came up during the interviews that if programs were recommended or explained by friends, that was a facilitator also attending seminars or workshops together with others. In offers that are typically attended by women, for example, yoga, it would be good for other male participants to see who else is going there, that they are not the only men participating. Also involving the family for group activities was seen as a facilitator, and embedding programs in clubs or associations. That's very powerful as well. And then also all the active men, they serve as role models. As this one younger man said, you regularly meet 70 to 80-year-olds on the mountain, and that's a strong motivation. So to see how fit you can still be when you're older, that you have to do something in your younger years. So what we've seen is basically three groups of men. The self-organized men who actively manage their health, and who self-organize their health-promoting behaviors. No action is needed for them. They already do everything themselves. They don't have to take part in any health promotion activities. Then there are the skeptical men, those who reject or oppose the structured programs or offers. Most likely it's a wasted effort to get them to participate somewhere. There's really limited potential for motivation, so we don't need to target them. But then there's this group of undecided men, those who are interested in health, but they are not yet active, and there's really the greatest potential for impact. And these are the ones that can be motivated with the right interventions. So to sum up, men favored health promotion offers that generally interested them and address the concrete need, and offer the clear purpose and the personal benefit. So this all has to be already visible before they sign up for any program or seminar. And in terms of the formats, they should be engaging and there should be credible facilitators. Otherwise, the participation was seen as unnecessary or not appealing. Further barriers were the traditional gender roles. These are still prevailing. The low perceived need for any health promotion activity. Of course, the lack of time or insufficient information about existing offers. And the key facilitator that I've been repeating through my talk is really that knowing that other similar men are participating, or that somebody else drags you along. So thank you very much for listening to me. We have finished a report of these interviews already in German, and also the report on the findings of the qualitative evidence synthesis. So if you can speak German, then you're most welcome to download them. But we're also working, of course, on our English speaking publications, and they will be out soon. If you have any questions, you can also email me, and I think we do have some time for questions now. Thank you very much.
Right, try and switch mine. Thank you very much, Ursula, for that. I'll shut up in a minute. Does anyone have any questions for Ursula? You could put your hand up. I think while we're waiting, I do have a question. Oh, Jude, you've got your hand up, so I'm going to go to you because your question will be more interesting than mine.
I'm not sure
You
about
want to
that.
unmute.
Thanks, Ursula. Really interesting. I was interested in. Can you hear me? Sorry.
Sorry, I need to unmute you. Have you managed? No, should be unmuted.
Yeah. Can you hear me?
Can't hear Jude.
Sorry, I'm unmuted.
Oh, it's here.
Try again, Jude.
Can you hear me?
Yes.
Yes. Sorry, I was gabbling away. Thanks, Ursula. Really interesting. I was interested in one of your last slides around the implications and the 3 groups. And yeah, you said about the undecided men being greatest potential for impact. And I wondered about the self-organized men. You know, we do hear quite a lot of research around community-led approaches, the use of asset-based approaches, and whether that has come into it around how we can use that first group to motivate other men.
Yeah, thank you very much. So I was also doing some of the interviews myself, and we've talked to a young man who told us how he organized. He organized a group of men going to the gym and you know, building up muscle, and he told us how he does it. But I think then we also asked him if he was interested in, you know, doing that on a larger scale, but that was not interesting to him. So he just had his 5 folks, and they were going they were going to the gym, and it was really important for him to motivate them, but he wouldn't want to do it on a larger scale. So if we find many of those motivated people who organize themselves and take some 3-4 people with them, then that would be already yeah, that would be really beneficial. I'm just not sure if you can, you know, have a formal structure for that, and how you can keep motivating these people, because it's their own motivation, and yeah, they're volunteers kind of.
Mm-hmm. Thanks.
Any more questions for Ursula? I've got one, Ursula. I thought it was really interesting that people said the municipal offer was not attractive. And so I wondered if you had an example of the sort of thing that was attractive. Because I was thinking, you know, over here we have like the Leeds football club people, and the Leeds Rhinos do a lot of things, that they go to schools and they do things that people get involved in. Is sports as popular in Lower Austria?
Yes, absolutely. But I think, you know, the sports clubs, that was not something that they would categorize as a municipal health promotion offer. It was more like, okay, there is a seminar offered by the municipality on how to reduce your stress, or there is a program for weight loss, and these kind of things were not attractive to the younger men, because usually more middle-aged or older men would go there, and so and more women, of course, and then they would not think that, you know, they are the target group for that. But of course, the sports offers, they are interesting also for the younger ones. And we have presented these findings to our practice partner. So the practice partner, they're called Tut Gut, and they are offering health promotion support and also health promotion programs in the municipalities. And what we would like to do in future is to work with the firefighters and to see what kind of activities we can implement in this group of men.
Thanks, Ursula. That's brilliant. And I think we've got time for one more quick question. So yes, is it Virginia?
Yes. Now, so I just had the question, if there any specific reason why you exclude a group of men, so 30, 45?
Why we excluded them? Yes, so we worked together with our practice partner, and we had to choose an age group, or these two age groups. We couldn't just go with the whole range, and the younger ones and the middle-aged and older ones are the ones that they have particularly difficulties recruiting in their programs, and so that's why they wanted us to look at those specifically.
Just thank you.
Thank you.
Thanks, Ursula. So we had some technical issues today, because this is the first time we've tried this hybrid format. So I hope that's not put anybody off. I just want to say thank you to Ursula for joining us and giving such an interesting seminar, and thank you to everybody who has attended, and I hope you enjoyed that. And we will be sharing the recording later on, is it LinkedIn and possibly YouTube, but we'll put the link on the LinkedIn, and we'll share the slides as well. But as Ursula said, do get in touch if you've got any more questions. The next session is January the 19th, and at 12:15 again, and we'll be sending more details around about that. So have a lovely rest of the day, everybody. Good health.
Thank you.